All right. Serena and I wanted to study COVID cases related to state reopening dates. So we wanted to see whether or not opening earlier or later really impacted the cases. So we picked a sample size of 7 states, New York and New Jersey because we're in this area. And then we also picked California, Texas, Arizona, Georgia, and Florida because they've made a lot of news lately. So on the first state we're going to talk about is Arizona. They opened on May 8th. And you can see the timeline basically and where they've gone. And on June 29th, they started rolling back some of those reopening plans because the cases started getting out of control. And of important note, there is no statewide mask mandate yet in Arizona, and the requirements are left up to each individual local municipality. And on our next slide, you can see the daily cases. So as I mentioned before, May 8th was the opening date. And everything was under control, and then it started running away from it, and deaths followed. And as we used earlier in the semester, we Google mobility data as a proxy for social distancing. You can see as most of the country was locked down, or in some version, mobility was down to about 55% from normal. And you can also see the dip in July as cases start spiraling. People engaged in social distancing on their own without any requirement, fear spread. And, we used some open source data on the R0, which is transmission rate compared to cases. So it's again from May 8th, you see the cases, the R0 was a little bit above 1, and the transmission rate is a leading indicator. So as it's going up, the cases start spiraling out of control a few weeks later. And you're going to see this pattern repeated for many of the following states. Georgia was famous for being the first state to reopen, right? Everybody remembers they made a big deal about it. Even President Trump actually kind of hinted that he probably shouldn't open so early. So here they are. On April 24th, they opened gyms, fitness centers, and the following list. And a few days later, they started opening up restaurants. In fact, Georgia does not have a mask requirement. And even though local municipalities such as Atlanta have tried to institute it, the governor is actually seeking to block those municipalities from issuing mandates. They're actually going to court to sue to block, say, Atlanta from having a mask mandate. Same thing. April 24th is approximately here. About 6 to 8 weeks later, the cases start to spiral. So we've noticed that there was there's a lag time from the opening to when the cases start growing. So it's about 6 to 8 weeks before cases start to really appear beyond what the states are accustomed to. Again, the social mobility data is a proxy for social distancing. Here we go. April 24th, and now you see the R0 actually starting to rise, going above the marker of 1, which means there is community spread. When transmission's under 1.0, it means the amount of cases, active cases, are actually decreasing over time. But when it goes above 1, you're actually having community spread now. And the cases now, again, it indicates that cases do grow following spikes in the transmission rate. Florida, which has become famous for the amount of daily cases, they opened on May 4th. And you can see that they had restaurants, and you can see the list. But they recently, as of June 26th, they closed bars down again because cases were exceeding what they could handle in the medical care system. The mask requirement, there is no statewide mandate again, but individual counties and municipalities were given the authority to issue them. They were advised to wear masks in public and social distance when possible. The data, so we go from May 4th at about a 6 to 8 week lag time, and bottom is the social distancing, and again through Tableau we were able to track the R0 compared to cases. And Texas, they opened on May 1st with Governor Abbott. You can see from the list of the various dates on which things were opened. However, on July 2nd, a mask mandate did come into force for all counties that had more than 20 cases. And in order to enter business or public buildings, or when outside, when social distancing was not possible. So you go from May 1st, get out about 6 weeks, and the cases start showing up. And the mobility data, Texas didn't shut down as much as some other states. And again, from early May, the transmission rate was hovering about around 1. It did spike up, and the cases followed soon after. I would say that these graphs, we ran out a little bit of time, or else I would have done it on a per capita basis for the cases, because the various states have different populations. So the graphs are a little bit outsized for some of the larger states. And now my partner Serena will be covering California.
Can you see my screen now?
Yes.
Okay. Yes.
Okay, so thank you, Stanley. Then let's take a look at what was happening in California. On May the 8th, California reopened manufacturing, some retail business, logistics, childcare, and outdoor museums. About 2.5 weeks later, on May the 25th, they continued reopening malls, restaurants, as well as school with modifications. Let's keep this date in mind and look at the data. Not surprisingly, mobility began to increase after the reopening and did not stop until late June. The daily new confirmed cases increased slowly at first after the reopening, and then increased dramatically from June the 20th. The daily deaths increased a bit later than daily new confirmed cases. I assume it could be because people who realized that they were likely to get the virus went to the hospital for medical treatments. When we look at the tableau graphs here, we can get a similar conclusion that new cases increased dramatically in mid-June. Let's get back. On July the 13th, the state announced to close all bars and all restaurants, movie theaters, and museums for indoor operations again. Let's go back to the graphs again. Then daily new cases started to decrease 1 week after the cancel of reopening, but daily deaths did not change that much. And mobility decreased as well. The mask requirement policy in California was since June the 18th. Masks were required at indoor spaces and in public where social distancing was not possible. Let's then take a look at New York. There were 4 phases of reopening in New York State. The first phase was at the beginning of May. Some regions and some industries were allowed to reopen. The second phase was at almost end of May and was still for portions of the state. Offices, outdoor dining, and barbershops began to reopen, as well as businesses in the professional services, such as finance and insurance, administrative support, and the real estate and rental leasing industries. In the third phase, restaurants and other food service businesses were allowed to reopen at 50% capacity. Meanwhile, social distancing and wearing masks were required until seated. In the last phase, schools and low-risk arts, entertainment, and recreation business reopened, all with social distancing required, but not movie theaters, shopping malls, or gyms. The mask requirement policies in New York State started from April the 17th. New York State required that masks were to be worn in public and in situations where social distancing was not possible. When we look at the graphs here, we find that although New York State, especially New York City, was almost the first place where the virus broke out, with daily new cases and deaths decreased in mid-April. the graphs here look quite different from the prior states. New York State reopened like what most other states do and did not close again, but the amount of new cases and deaths were under control. The critical difference was mask requirement policies, I think. So we could thereby infer that masks could be an important factor. The similar situation was in New Jersey as well. New Jersey gradually reopened from May the 2nd till today, and I assume the government will continue reopening in the future. However, daily new confirmed cases decreased from late April, and daily deaths decreased from the beginning of May. The mask requirement policies in New Jersey was that face masks have been required when entering essential businesses since April the 8th, and 3 months later on July the 8th, face masks have been required outdoors when social distancing is not possible. Based on our research and the data, we can make a conclusion that individual policies regarding reopening in different states matter less compared to wearing masks. In other words, I personally believe that reopening itself may not make the situation worse as long as people wear masks correctly. If masks do not matter that much, then New York City, with its reopening, could be experiencing major case growth again. And thank you for listening to our presentation, and feel free to ask any questions.